evening, everyone, and welcome to the second annual National Kids and Vaccines Day. I'm Dr. Catherine Smart, and I'm thrilled tonight to be with you as your host and moderator for this exciting evening. Together, we have some of Canada's most knowledgeable minds in health and science for you tonight, and we're going to be diving into your questions about vaccines, including and especially tonight, a focus on routine childhood vaccinations. So before we begin, let's take a moment to put our feet on the ground and acknowledge the land that we're on. Although we're gathering online this evening, it's important for all of us to take a moment, wherever you are in the country that we now know as Canada, and acknowledge the original homelands of the distinct and living Indigenous cultures. I'm joining you tonight from Kelowna, British Columbia, which is situated on the traditional and unceded territory of three interior Salish nations, the Syilx, the Secwepemc, and the Inquilipamakuk peoples. If you'd like to learn more about the Truth and Reconciliation Commission and the steps that you can take as a settler on these lands, we're putting a link for you in the chat. This is, of course, a night of learning. So if you're interested in learning more about the land you now call home and to get to know the cultures of the Indigenous peoples in your community, you can also visit the website nativeland.ca, and you can also find that in the chat. So I'm really thrilled that all of you are here and joining us tonight, and I want to thank you for taking the time out of your evening to be here. And I also want to give a shout out to the event organizers for tonight's webinar. The Canadian Association of Science Centres, which is the parent organization for Science Up First, and Children's Healthcare Canada are so pleased to see so many new and familiar faces here with us this evening. Following tonight's event, we hope that you'll continue to engage with both organizations as they continue to do important work of providing you with the best available science and health education to benefit you, your children, and the people that you love. Now let's look into some of our housekeeping issues for tonight. First, you have the option to turn on closed captions with the button on the bottom of your screen. French audio for today's discussion is also available using the interpretation button. In terms of answering questions, over the last week, we've collected a number of questions in advance through our various networks, which we will be using tonight to start things off. If you have questions you'd like answered tonight by our panel of experts, please feel free to use the Q&A option to submit this at this time, and we'll come to those after our initial discussion. We're going to do our best to answer as many of your questions as possible live in our panel discussion. However, if we don't get to your question live, don't worry. In the background, we have several people moderating the chat, and they're going to do their best to answer as many questions as they can in writing. All of tonight's behind the scenes moderators are public health and science experts, so you can be sure you're receiving the best available science from expert sources. So now I'm very excited to introduce you to tonight's extremely accomplished panelists. First off, we have Dr. Cora Constant. Oh, I've been practicing this, but I'm going to get it wrong. Constanescu. She is a pediatrician, an infectious disease physician, and a clinical associate professor at the Alberta Children's Hospital in Calgary, Alberta. Her focus is on seeing vaccine hesitant patients in her clinic, and her academic pursuits are also around vaccine acceptance and surveillance. She has a strong passion for vaccine research and promotion. She also holds a master's in medical education and specializes in development. She's applied these skills to vaccine education for healthcare workers and the public and continues to be a vaccine advocate at local and national levels. We also have Dr. Javed Alu, a community-based family doctor in Toronto and an educator on integrated physical and mental health care. Dr. Javed works for the Centre for Addiction and Mental Health, Trillium Health Partners, and the Canadian College of Family Physicians. Dr. Danielle Pays holds a bachelor and a doctor of pharmacy degrees from the University of Waterloo. She is also the chief pharmacist officer at the Canadian Pharmacists Association. Danielle's passion is for serving the pediatric population, and this was reinforced in her previous role as a clinical pharmacist at Holland Bloorview Kids Rehabilitation Hospital, where she cared for many children with complex medical, physical, and developmental challenges. Recognized as a dynamic and forward-thinking pharmacist, Danielle is committed to optimizing health outcomes for children and is passionate about promoting equity and inclusion for kids of all abilities. She believes pharmacists play a key role in healthcare delivery in their communities, providing a trusted source of information and services, including vaccinations. Patricia LaForce has been a registered nurse since 2013. She holds a bachelor's degree in nursing science from Laval University and a master's degree in nursing science from the University of Montreal. She has been interested in procedural pain management for several years. As part of her master's thesis, she observed the effects of therapeutic clown distraction on children's pain and anxiety during vaccinations. She worked for 4 years in pediatrics at St. Jerome and joined the CHU St. Justine team in 2017. She has developed expertise in surgery and traumatology and severe burns. Since May 2021, she's joined the To-Do team, an institutional comfort initiative that's aimed at improving procedural pain and distress management for children. Within that role, she plays a leadership role in training of healthcare professionals and is responsible for the development of the project across the hospital. And finally, a little bit about me. I've been working in pediatric medicine now for over 20 years, and my current practice is in Whitehorse, Yukon, where I work with children who have largely experienced trauma and adverse childhood experiences. Before that, I was a pediatric emergency medicine physician at the Alberta Children's Hospital in Calgary, and I've also had the privilege to work at the Royal Children's Hospital in Melbourne, Australia, and I'm currently the past president of the Canadian Medical Association. So without any further ado, let's dive into some of the questions we've received from Canadians across the country about kids and vaccines. So I'm going to start with Javid. Javid, can you tell us, will children be protected if they don't get vaccinated according to schedule? And is it dangerous to delay vaccines?
That's a great question. I think the reason parents are asking the question is to make sure their kids are safe, they can have a good, healthy childhood, play all the games they need to be involved in, also have a healthy school year. And I think that's the reason why we're looking at what we talk about vaccinations do for them. And so the whole point of vaccinations is obviously to train the body upfront how to fight an enemy before it comes to them. And so if it's delayed in training, then if they encounter the dangerous virus or bacteria before they're vaccinated, they don't have the advanced chance to build a stronger immune system before they encounter the infection, which means they have a higher chance of being sicker or getting hospitalized if they're not vaccinated with enough time to prepare the immune system in advance. Now, some vaccines also require multiple doses, and it kind of makes a lot of sense. And that's the reason you notice, for example, why children in that first year of life get multiple shots. Because like most things learning, they don't learn quickly. You got to teach them, say, mama and dada, many, many times before they actually learn how to do it. And with the vaccine, it's no different. They actually need multiple reminders of how to learn to fight it, because they don't remember very well. But after they're 1 year old, they actually can get that one shot, train really, really well with it, and that tends to last longer. And so the whole idea is we want to give them as much advanced training as we can. If they haven't had the full schedule before they get the infection, they'll be less well protected, but still partially protected. So any amount of training they can get up front is helpful. So delay is not a great idea because they're vulnerable to the infection at the beginning, but better sooner than later. And the full series before they get the infection, if they're encountering the wild, the better.
That's great. Thank you, Javid. So sticking with you for a minute, for someone who's fallen behind on their kids' routine vaccines, and we know right now that's actually 1 in 4 Canadian children, so it's a common problem. How should those families catch up and how quickly can they do that?
Great, that's a great question. So obviously it made sense in the early part of the pandemic. We kind of held back and saying, hey, this is a preventative thing. And if kids are at home during that early lockdown phase, they're not going to encounter those bugs. So we could afford to delay during that phase where it was safer to keep them home. But now they're going to be mixing with kids everywhere out there and more exposures. And we're seeing kids are getting more sick because suddenly now they're spending more time with more kids. So this is when you want to get started with the vaccines. You also can give many vaccines at the same time. So we actually know which ones we give at the same time. So no need to delay and give only one a week. The body is designed to handle so many different exposures of pathogens coming to the same time. We can handle many shots at the same time, maybe just fine in doing that. So you'll talk to your doctor, your nurse, your pharmacist, and see, hey, which ones can I give together? Which are the most serious ones to give up front, and give those to begin with. And those we can actually get through the series faster. And since there's many minor illnesses like colds and stuff, we can actually give vaccines at the same time. So that doesn't require you to delay the shot. So you can get that going off the bat. But certain infections, and we'll come to many different shots we're talking about today, like the COVID vaccine, if you have COVID infection, it delays when we can give you your dose or your booster much later. So when you're well is a great time to get these under the belt and done with, so you're healthy before you get other infections in the field.
Awesome. Thank you for that. Cora, I'm going to come to you now. One of our social followers is asking, why do I still need to vaccinate my child if no one in my community ever catches diseases like polio, measles, and whooping cough?
Yeah, thanks for that question. I so wish that we didn't have these diseases to worry about. And in Canada, we're really fortunate because we certainly don't see the same number of kids die and end up in hospital of vaccine preventable diseases as in other parts of the world. But we certainly are still seeing a lot of these vaccine preventable diseases in our communities, and then they end up in our hospitals. And I can see that if you don't work in a pediatric hospital, you may not see them. But I started working around 2008. And since then, since I've worked in a pediatric hospital, we have seen at least 3 outbreaks of whooping cough, and we've also seen deaths from whooping cough, which is a vaccine preventable disease. I've seen meningococcus disease put kids in ICUs, and we've also seen deaths from meningococcal disease in Canada. We've even seen Haemophilus influenzae meningitis. We've seen chickenpox put kids in ICU, and as the last few months have shown us, we still see influenza, a significant burden from that disease as well to our kids. And before the pandemic, our vaccination rates were high, but for most of these diseases, they were not at that community protection level. And since the pandemic, we've seen a drop in those percentages even more. So I suspect that we're going to see more vaccine preventable disease outbreaks. For example, right now in the southern part of our province in Alberta, we're in the midst of a whooping cough outbreak. So these diseases are still here, and therefore protection against them, it's still worthwhile for our kids.
That's great. Thanks for going over that for us. So Cora, we have another one for you, and this is about vaccine rationale that came to us by video. So let's take a look.
Hi, I'm Stella, and I have a question. Why do kids need to get more than one vaccine? I mean, isn't one enough?
Stella, by the way, great question. I so wish that one was enough, Stella. I'd be right there just getting one vaccine. But you can think about this. It's a bit like your immune system, which is really what the vaccines work on. It needs training. Imagine you're running, let's say, a marathon. You can't just go out for a run once and expect to be able to do kilometers and kilometers of running right after that, because you need to build that muscle strength and you need to build that memory of your muscle memory with repeated training. And it's the same with the immune system and vaccines. Now, some vaccines are better at training your immune system than others. So for example, hepatitis A vaccine, you really only need 1 dose. But most of the other vaccines, you need to have at least 2, sometimes 3, sometimes up to 5 doses, because it takes that long for the immune system to learn and train to perform well, so that when the time comes to test itself, when that disease is there, the immune system is ready and fully trained. Now, I'll tell you, the other thing that's really kind of fascinating about vaccines is that the age at which you get a vaccine also makes a big difference. So for example, in grade 6, and in some places in grade 5, we give vaccines which are cancer preventing vaccines, such as the human papillomavirus vaccine. And that vaccine, if you give it to kids between 10 to 14 years of age, their immune system is so robust that you only need to give 2 doses. Whereas if you give it to them later, let's say over the age of 16, you actually need 3 doses to train the immune system. So it's all about that training of the immune system. And most of the time, it doesn't learn just from 1 dose.
Thank you. Danielle, we'd love to hear from you on this topic too, because it's such a great question. Why do you think some vaccines require only 1 dose while others require multiple doses?
Yeah, it's and I'm going to build on some of the points that we've already talked a little bit about. But basically, your immune system is going to respond differently to different viruses. So just like we're all unique, different viruses have different elements and components to them. And so the goal is to create the best immune defense possible. And so in some cases, some vaccines, you can get a long-lasting effect and protection with 1 dose. And in other cases, like we mentioned, your body needs a little bit more exposure and a little bit more kind of like practice, practice sessions, so that by the time you actually encounter the virus or the bacteria in real life, your body's like, hey, I recognize you. I'm ready for you. I got all my defenses in place. And so really, it's dependent on the vaccine, and it's all based on studies, and a lot of science and a lot of research has gone into figuring out what the best dose and number of doses will give the majority of us a really, really strong, long-lasting defense and protection, so that we're ready to fight those viruses when they present themselves. And so yeah, I think that sort of answers the question.
That's great. Thanks, Danielle. And I love your point about just the amount of science that's behind vaccines. I think a lot of people don't always realize that they're some of the most researched and most well followed medical interventions that we actually have, and have some of the best science and evidence behind them. So that always gives me a lot of confidence as a pediatrician when I'm talking to my families and patients about vaccines. So, Danielle, when it comes to vaccine administration and safety, is it safe for a child to receive additional vaccines if the parent's not totally sure if they'd been immunized with those same vaccines in the past?
Yeah, so this is, again, you want to talk about the science. So really the goal here is to make sure that your body is prepared and has an immune a defense system ready. And so, it's very common for people to lose their immunization records. And I wish we had a more robust system, but you move, and there's a lot out there that are influencing how we keep track of all these vaccines, and if you have multiple kids, whatnot. That being said, it is safe to, and there's a long history of experience with vaccines in the healthcare system, so that it's actually better if you don't know, if the status of your vaccination is unknown, to get the vaccine so that you have that protection. There are some tests that you can do for certain vaccines to see if your body produces antibodies, but in most cases, if you don't know, it's actually better, and you can have these conversations with your healthcare provider. It's better to assume that you don't have the protection, and to train your body and to give your body the vaccines it needs, so that we can ensure that you are protected.
Thank you, Danielle. Patricia, I'm going to turn to you. A question on the minds of many parents and caregivers is how they can help prepare their child and reduce the stress and pain of giving vaccines, especially if they've had a negative experience in the past. We know this is an area you have a lot of expertise on. So what can parents do to make it a more positive experience for their child?
Yeah, so various evidence-based strategies exist that can help your child prepare for needle-related procedure. Preparation can be broken down into 3 parts: the before, as well as what you can do during and after the vaccine. Before a vaccine, explain to your child what would happen, such as the steps and sensation that they can feel. For example, a pinch or pressure. It's important to avoid terms with negative connotation like needle or hurt. Discuss with your child what you can to make them more comfortable during the vaccine, such as bringing their favorite toy or comfort item and using a numbing cream. It's strongly recommended to apply topical anesthetic cream 1 hour before the injection, as it reduces children's pain. Numbing cream are available in pharmacies without prescriptions. Different strategies exist that you can use during the vaccine, such as distraction, positioning for comfort, and deep breathing. Distraction helps divert attention from the procedure. With your child, you can recite a story, watch a video, listen to music, or play I Spy in the room. Using a comfort position can also help your child feel more secure and calm during the procedure. Your child can be sit on their own, or if they are younger, they can sit on your lap or in a hug. Deep breathing can help you and your child relax during the vaccine. Various techniques are available that you can practice at home prior to the procedure. Finally, discuss with your child what you can do after the vaccine to celebrate together, so they have something to look forward to afterwards.
Thanks, Patricia. Those were like lots of great suggestions there for the families listening in. Speaking about side effects, our next question is for Javid, and we have another video submission. So let's see what Jordan wants to know.
Hi, I'm Jordan. I want to know why some people get sick from the vaccine because of the side effects.
It's normal to have certain reaction to the vaccine. Obviously, the vaccine is doing something in your body, and that's why we're taking it. What it's doing is actually pretending to be the enemy, the virus or bacteria, and showing your body, hey, this is a decoy that looks like the thing that you'll learn to fight. And so many of the reactions we have are actually the normal way our body's immune system reacts when it's actually pretending to fight an infection. So similar, many side effects are similar to what you'd have if you had another infection, like you might have a fever, you might have a sore arm, because blood is going to the area to fight what it thinks is the enemy. And those swellings that you have, the sore arm, these are normal reactions of the body being called to recognize the vaccine, which is pretending to be the enemy. Mount the response, your blood dilates, you get the swelling there. You might even get your lymph nodes in your armpit kind of swelling up a bit, all perfectly normal, natural training of the immune system and revving it all up to fight. So these are good reactions. They're not actually bad things, the things we expect to see. And so we tell people as much as possible, you want to keep things as normal and natural as you can. So put ice in the sore arm to make the swelling be less sore or go down a bit. If the fever is super high, more than 38, consider taking Tylenol. But as much as possible, we want to keep things natural. So drink lots of water, give it time, and this is how your body fights the reaction, learns to fight the bacteria by getting trained with the vaccine.
Thank you, Javed. Cora, I'm going to come back to you. There may be parents listening whose kids have medical complexity or chronic conditions. Are kids with chronic medical disease at greater risk of bad vaccine reactions? And are there any routine vaccines that those children should avoid?
Yeah, so we get that question quite a bit. So I'll tell you what we know about kids with medical complexity who are having vaccines or vaccine preventable diseases. We know that kids who are medically complex are at higher risk of having bad outcomes from the disease, and more so than any reactions they would get from the vaccine. So take something like influenza. We know that it can affect healthy kids, but if you have a child who has a neurological condition or respiratory disease, for example, that child is much more likely to end up in hospital with the flu. And the only and typically what we highly recommend to kids with medical complexity is that they have all of their vaccines, because the risk of the vaccine preventable disease in them ending up in hospital having bad outcomes is actually higher than in the general population of kids. So we don't typically tend to make adjustments when it comes to vaccines, except in some severe cases. And I'll give you an example. The only, and I should say that the only group for whom we're very careful with vaccines, and that's specifically live vaccines, are those kids who have immunosuppression or some kind of inborn error of immunity. So kids whose immune systems, for example, they might have had chemotherapy, or they might be kids who have a transplant, so therefore they're on immunosuppression, so as to prevent rejection of that organ. Those kids we would not give live vaccines to typically. The only time I will have a discussion outside of that group with a family is children who have very severe epilepsy and who sees a lot. And sometimes their parents are really, really worried, because these kids can go into something called status epilepticus even with a cold, or anything that could really trigger an immune response. And sometimes the parents are worried that a vaccine might actually trigger a seizure in these children. So sometimes what we'll do for those kids, we will split up some vaccines. And the one typically that tends to be more split up is the measles, mumps, rubella, varicella vaccine. That's typically given as 4 vaccines into one, but it has a slightly higher likelihood of febrile seizures. So for example, if you give the whole vaccine as one, there is 8 in 10,000 cases of febrile seizures. Whereas if you give the vaccine as 2 vaccines, the measles, mumps, rubella, and the varicella, even if you give it at the same time, but it's 2 separate vaccines, then the rate of febrile seizures goes down to 4 in 10,000. Even 8 is still a very low number when you think about 10,000. So is 4. But sometimes to decrease that risk, we might split that vaccine and say to those kids, we may give a vaccine that has the measles, mumps, rubella in it, and then another vaccine that has the varicella at the same time, as opposed to giving the whole 4-in-1 vaccine. But we only make those adjustments in quite particular severe cases, and we typically don't, because we want kids, especially those with medical complexity, to be as up to date with vaccines, including influenza and COVID vaccines, as possible.
Great, thank you for that. Another really common question we hear about childhood vaccines, and I think something that worries a lot of parents, are 2 things. One, is there any evidence that vaccines cause autism? And is there any link between vaccines and sudden infant death syndrome?
Yeah, so those are both can be very scary, especially when you talk about sudden infant death syndrome or SIDS. It is awful and incredibly scary. I know I worried about it with every one of my kids, and I have 3 kids. And it's specifically because we don't often find a cause for SIDS death, and it coincides with when we start vaccinating babies around that 2 to 4 month of age. So naturally, sometimes people say, well, could the vaccines cause SIDS? And I think it's a very legitimate question to ask. The good thing is that even though this has gotten quite a lot of press in the anti-vaccine media and on anti-vaccine sites, we now have a lot of studies that have looked at that particular question. So a lot of science that's backing this up. We have multiple research studies and a few safety reviews. So people go back and review safety in any of the possibilities of these maybe correlated cases. And when they have looked, that they don't see any possible links between vaccines and SIDS. And this evidence accumulated over many years, which is also reassuring. What did really decrease the rates of SIDS or sudden infant death syndrome is the Back to Sleep campaign, which started in the 1990s. And what's interesting is that even though we now have more immunizations added to the children's schedule, since then, our SIDS rates have not gone up. More support that vaccinations do not cause SIDS. Now, it's a similar story with autism. And now we're starting to understand more about what causes autism, but we don't always know the causes of autism. And again, there is a correlation in terms of timing. So around 12 to 18 months of age, so when kids are a year to a year and a half, is when you expect them to start talking and interacting with parents. So that's when the suspicion of autism tends to happen in families and in those kids who actually have it. That's also coincidentally when we protect kids with the measles, mumps, rubella vaccine, that 12, 18-month age group. And again, the measles, mumps, rubella the vaccine was mistaken as a cause for autism. However, like with SIDS, we have so many studies that show there's no correlation between this vaccine and autism. And actually, they had a study that looked at kids who are high risk. So they looked at siblings of kids who have autism. And even in that population, those siblings who are the highest risk because they have somebody in their family with autism, even in that population, there was no association between the vaccine and autism. So I feel I can say with pretty good confidence that the vaccines don't cause autism and they don't cause SIDS.
Thank you, Cor, for that great explanation. And again, I think it just really highlights just the huge body of evidence we have around vaccines and their safety. So as a parent myself, I also find that very reassuring. So Danielle, I'm going to come back to you. Another common thing that we often hear people talk about is this term live vaccines. Can you tell us what is a live vaccine and is there any way it could harm a child?
It's a really, really great question. And so a live vaccine essentially it contains a live virus of of the disease that you're trying to prevent. And what's typical is that even though it's a live vaccine, it's been treated to weaken it. So it's less able to actually cause the illness, but it stimulates the body's immune response and it produces antibodies. So that live vaccines what's exciting about it is that they induce an immune response that mimics a natural infection, which often creates a more effective, long-lasting immunity. So for some infections, the live vaccine produces a much better immune response than vaccines that have like components of the virus or bacteria. The other thing that I want to mention is that there are certain situations where live vaccine is not recommended. And so as mentioned before, if you have a condition or a disease that causes your body to be immunocompromised, so your natural body's defense systems are weakened, or if you're taking an immunosuppressant agent, so medication that's sort of suppressing your immune response, or if you're pregnant, there are situations where the risks are a little bit higher, and it's possible that with a live vaccine you might get sick. So those are all conversations that you can have with your healthcare provider. But for the most part, live vaccines actually provide a really great training practice for your body to build up its defenses.
Awesome. Thank you so much. So Javid, I'm going to come back to you. For people that don't have a family physician or a pediatrician, which unfortunately is many Canadians, how can they go about getting their child vaccinated?
And that's a very timely question. I was just checking the stats. I know there's about 6 million Canadian adults who don't have a family doctor, and even more kids if we add the numbers in there right now. And so we want to make sure that they're safe. And the whole point of this is we want them to have healthy lives. So prevention measures like vaccines are so important because we want kids not to get sick, not to end up in the hospital, and have a good life. So there's a couple of different ways they actually can go about things. So we really want to make sure it's accessible and available and convenient for families. So many cities in their public health departments will run clinics for vaccines, and that's one place to get started with. Some vaccine programs are given in schools, and that also makes it easier there. There's urgent care or walk-in clinics that run, and typically they'll have all these childhood vaccines available. So you come in at the right time, and they'll make sure that your kid gets it. And then also there's pharmacies in every corner. And I think many pharmacies, not all of them, but many of them actually do offer a number of vaccines. Depending on where you're in Canada, the ages that the pharmacist will give vaccine may vary. Some at 6 months, some at 2 years and older. So just checking that part, but there's many, many different ways. Aside from your family doctor, and many times even regular family practice may have days where they're doing vaccine clinics and be more open to taking patients who aren't enrolled with them for vaccines.
Great, thank you. And I know where I live in the Yukon, it's all run through public health. So that's another thing that we commonly see.
One thing, actually, the main thing is, as I mentioned earlier, we don't want to make sure that the record of vaccine gets lost. And so there's a great app we'll put in the chat. It's actually the Can Immunize app. It's free for parents. You can log your vaccine records there on your phone. It stays on online server securely. So you can access it if you need to later on and take it when you have other providers.
That's great. Thank you for sharing that. So now to prepare for those vaccines, Patricia, we're going to come back to you. We have another video question.
Hi, I'm Gwen, and I'm always nervous to get vaccines. What could I do to help?
That is a great question. Here's how you can help. Have your parent help you put on numbing cream 1 hour before the vaccine. Decide what you will bring with you to the vaccine that would help distract you. It can be a book, music, or a tablet. Practice how you will sit during the vaccine so you are most comfortable. You can sit alone or with a caregiver. Take some deep breath before and during the vaccine. Discuss with your parents what you can do after the vaccine to celebrate together. And don't be afraid to ask questions or share what works best for you with the healthcare professional so that they have the best, so that you have the best experience possible. Sorry.
Thank you. And Patricia, we also had a question from a healthcare provider, a healthcare professional who wanted to know what they could do to make the immunization experience as pleasant as possible for the children that they're caring for. So what suggestions do you have specifically for those of us in healthcare?
Yeah, healthcare professionals should introduce themselves and explain the sequence of events in order to prepare the child and family. Healthcare professionals should explain the role of the child and their parent during the vaccine, the procedure, and provide positive instruction. For example, for the child, can you help by keeping your arm still when I count to 3? Healthcare professionals can inform parents and on the availability of numbing cream in pharmacies without prescription. They can also encourage parental presence during the vaccine, such as positioning for comfort or distracting their child. Finally, healthcare professionals can promote the use of breastfeeding or sucrose to reduce procedural pain for infants. Healthcare professionals can consult the card system available online to help them with vaccination in schools.
Great, thank you so much. So I want to thank all our panelists. That was a really fantastic Q&A. And now we're going to move into some of the questions that we've received from our live audience. So Javid, I'm going to start with you. We have a question from Meg who's asking, what vaccines are recommended for children before kindergarten?
That's a great question. So actually, there's a whole series of vaccines given in their first year of life that cover everything from whooping cough. And then you even get the measles, mumps, rubella vaccines prior to your 1 year mark as well. So there's a whole series covering bacterial infections as well as virus infection we're looking at in that time frame. So these are the best ones because these are the viruses and bacteria they'll encounter when they actually see kids in daycare or in school whenever they're heading there. So there's the DPTP or an Haemophilus influenza vaccine, what's called PDSL oftentimes. There's Prevnar vaccines that look at pneumonia preventions as well, that also prevent sort of meningitic infections too. And as I mentioned, the measles, mumps, and rubella infections. And the really important reason to actually want to get these vaccines in advance, so I'll talk about the rubella vaccine or the measles vaccine in particular. So we know that if kids actually get the measles infection first, it's not just the sickness and illness they can cause at the time they've infected, but measles also damages the memory that the body may have built up to other infections over time. And so what that happens in those cases, kids who get measles infections actually can get sicker from other infections for up to 3 years afterwards, and there's a higher death rate from those other infections. So vaccinating upfront protects not only the kids before they end up in daycare or in preschool, but also for years to come from bad outcomes.
Great, thank you for that. Cora, I'm going to come to you. We have several questions coming in the chat around the COVID vaccine, which I think is not surprising because it's still, of course, top of mind. One of the questions that someone was asking is how we as Canadian pediatricians are taking into consideration the vaccine-associated risk of myocarditis when vaccinating for COVID. So I'm wondering if you could tell us a little bit about the risk of the vaccine versus the risk of COVID itself and how a parent can sort of weigh those risks.
Yeah, so so let me first tell you a little bit about myocarditis from the COVID vaccine, which has been a very well recognized adverse event following this vaccine. What's interesting, however, is that myocarditis also happens with COVID, the disease. So it's believed that there is something about that spike protein that actually may lead to the myocarditis as opposed to the mRNA platform, for example. But the myocarditis rates seem to be the highest at the times when the baseline myocarditis rates in the population are highest in terms of the age groups. So typically happens after the second dose of the vaccine, within a few days of that second dose, and it's specifically in young adolescent males. So that 15 to 16, 17 age group is the most affected. And this is why you saw a difference in recommendations in terms of which vaccine to give. So we know that there was an association potentially with maybe the dose. So this is why the Moderna vaccine was now recommended in that age group, and the Pfizer vaccine was recommended because of concerns around that. And then what has been incredibly reassuring, and this is why it took so long, for example, to get a booster dose recommendation in some of these age groups because of concerns like this, was that with the booster, there was not the same rate of myocarditis seen, but we needed to know that in the 18 to 25 age group before we could move that down to that more prone to this reaction age group. So this is one of the ways, for example, that this was taken into consideration. Similarly, what we have seen is that myocarditis signal was not there in the 5 to 11 age group. So it's now nearly the same kind of rates, as a matter of fact. And again, it's reassuring because we know that is not at baseline a high risk kid population in terms of myocarditis. So it's not, it's something that people take seriously, that a lot of thought has been put into it in terms of when to recommend and how to recommend these doses. And this is why, and also the other thing that right now is still a recommendation is that if a child has had myocarditis from a vaccine, from the COVID vaccine, they don't recommend providing a dose afterwards or a booster dose, even though, now we're having even more information that says it doesn't seem to recur, which is also reassuring. So it's an ongoing thing that people are studying, but also reassuring in terms of the fact that it seems to be much more in that particular age group in males, and that most of the myocarditis seems to be quite mild. So kids don't seem to have any long-term effects, and of course that's still being studied because we only have about 2 years of data is at this point. Definitely considered a well-recognized side effect. But then the other thing that I'm just going to finish with, Catherine, is to say that when they looked at all age groups, even in that high risk for myocarditis age group, the risk of the myocarditis severity from the disease was still higher than it was from the vaccine. So even in that high risk age group, the equation, that balance that we're looking at between the benefit of the vaccine versus the risk of the disease was still in the favor of the vaccine.
Thank you, Cora. I think that's such an important takeaway for people, is that the risk of myocarditis is higher from getting COVID itself than from the vaccine. So thank you for explaining that. So Cora, I've got another one for you. This is from Erin. She's got an infant, a 6-month-old, who got his first COVID shot, the Moderna vaccine. And she had read that in this age, it was best to keep to one type. So if you started with Moderna, to continue with Moderna. However, she's in Ontario, and the Minister of Health just communicated that they will not have Moderna for infants for a period of time. So what she wants to know is, should her baby get a second dose of the Pfizer vaccine when he's eligible, which is in 2 months from now, or should he wait for Moderna to be available again?
Yeah, that's a tough one. And it just
Yeah.
shows how complicated this is for parents. And I feel for you. I know that I've debated this in my family as to what to do. And I wish we could take it all away and make it easier for parents. I really do. But under 5, so we did say with a lot of the age groups that we could just interchange these vaccines, the Moderna, Pfizer, and so on. And as a matter of fact, in some age groups they seem to be better, but we can't say that in the under 5 because of the way that the dosing differences are quite significant. So for example, in the under 5 age group, the Moderna is a 2-dose vaccine series, but the Pfizer is a 3-dose vaccine series, and they're not equal in that 2 doses of Pfizer are not the equivalent of 2 doses of Moderna. You have to finish those 3 doses of the Pfizer vaccine. So I can't give you exact medical advice in this town hall, but I think it's a worthwhile conversation to have with your healthcare provider because it comes down to timing. So you have to wait 8 weeks between the doses. So you have to kind of make this, this calculation of when your kid would be protected if you were to start the Pfizer series, and you'd have to start fresh. So you'd have to start the Pfizer series, not interchange it as if it's a Moderna series, versus hoping that maybe the Moderna vaccine becomes available, or maybe you can drive across the border to the next province and get the Moderna shot in time. And I don't know, but it's down to getting a little bit of that, negotiation there in terms of what's going to work for your family. But can I also say, kudos to you for protecting your child. Even 1 dose, it still has good protection against severity. Of course, we always want the series complete, so 2 dose is better. But just kudos to you for taking that step.
Yes, so I'm with you. I hope for Erin's sake that the Moderna comes back online, because I imagine you're not the only parent in that situation. And as Cora's explained to us, it is a bit complicated, unfortunately. So we have another question from Raza. Javed, I'm going to go back to you for this one. This person's asking, they're saying a lot of parents had mentioned to them that they felt that the COVID-19 vaccine is not mandatory or maybe important enough because it's not on the yellow immunization card and it doesn't need to be filled out, and schools aren't asking for proof of the COVID-19 vaccine like they are for other vaccines. So as far as you're aware, is there any plan to add this to the vaccination card or to make it mandatory for school attendance?
Sure, that's a great question, actually. And it went to the question, how do we make decisions to actually have it mandatory? Because that's actually a regulation that the government's passed through the Ministries of Health, typically for a region. And so first we want to make sure there's the evidence of value. And as everyone's talking about, what is the risk of COVID to a child versus the risk of the vaccine, and making sure, one, it's safer always to get the vaccine around the illness. And so I think the emerging evidence is how important is it for kids that they actually get the COVID vaccine. So we have actually new data from the US looking at what happened there. And so now they've actually identified that in the last year, COVID-19 was the leading cause of respiratory infection death in children. So it killed more children in the US than the flu, RSV, other pneumonias. And so that is a big change to see. So even though the risk per child of getting sick and getting deadly sick with COVID may be lower than it is for adults, among kids who don't normally get sick or die from these things, it's actually a really big reason because so many kids are getting infected over and over again. So they're kind of rolling the dice and gambling with their health every time they catch COVID, and all of them are gambling at the same time. So this makes it more important at a time than to decide about, making sure that you actually do get your child vaccinated. So I think asking the question as well, it's not just about what a regulation might say, because that's a process for government, but in terms of value for your child and safety, that's when we're making a decision today, what's safer, what's not as safe. It's safer to give the vaccine than to risk the outcomes of COVID. And that's how probably is the best way to make your decision for your child.
Thank you. I totally agree. Patricia, I'm going to come to you since you're our resident expert on pain control. So we have a question from a child who's 8 years old. They want to know, sometimes you get a sore arm after getting the vaccine. So if you have a sore arm after, what can you do about it?
I think it's not a question for me, but I can answer. You can take Tylenol or put ice on the injection site.
Yeah, absolutely. And great question, and probably the most common side effect that we see. Excellent. Okay. So coming back, we have another question around the COVID vaccine, and maybe Cora, we can come back to you on this one since you're our infectious disease specialist. This person's asking, why don't we have a booster dose recommendation for kids 5 to 17 after their regular 2 doses, such as the US has had? They're concerned that it's been so long since they had their primary series. So this person's wanting to know what's going on with boosters for kids 5 to 17 and how many COVID vaccines should children and teens receive at this point in time?
Yes. Okay. Again, complicated, but not that complicated in this case. Okay. So here goes. We do have a booster, and we do have a booster for all kids over the age of 5. And the bivalent booster has also been recommended by NACI right now in those kids, anybody over the age of 5 and older. Now, typical numbers in terms of doses is that you have a 2-dose series, which is called your primary series. So this is where you're like priming the immune system to get the best response possible to the vaccine, plus an extra dose as a booster, typically around 6 months later, or of course, depending on, and also depends on whether you've had an infection in between as well. But 6 months is typically post-infection or post the previous vaccine dose. The only time that changes is if you have a child who's immunocompromised or who has some problems with the immune system. So then it goes back to that training response earlier. You need more doses to get that initial priming of the immune system. So in that case, the primary series it's a 3-dose series plus a booster afterwards. The only age group we don't have a booster in is in children under 5 years of age, that we don't recommend it.
Excellent. Thank you so much, Cora. Okay, I think we have time for one final question. So Javid, I'll come to you for this one. Someone's asking here, they're wondering if you've been recently vaccinated, should you avoid visiting people who are more at risk of certain diseases? So like, should you not go to a neonatal ICU? Should you stay away from people who are immunocompromised if you've recently been vaccinated yourself? Is this a concern?
Sure. So in general, actually, I'm not aware of that being a concern, but I'll talk about the different kinds of vaccines, and that changes the game a lot. So if you're talking about protein subunit vaccines, where we took a tiny part of the virus that actually doesn't have anything living in it, it's simply like eating food, as it were. So your body kind of reacts to that, but there's nothing infectious in that process to give to somebody else. When you're talking about the other inactivated or dead viruses like the flu shots, again, there's nothing living that you could give to somebody else either. So the only living viruses are the measles, mumps, rubella, or the chickenpox or varicella vaccines, and those a child could have a mild case of illness with, and so that's the one you might consider that, hey, look, this is going to be super high risk. You wouldn't want to give them the mild virus, but it's a very, very low risk. I haven't actually heard of any cases of transmission, but that's a theoretical concern only in that scenario.
Thank you. Okay, we're going to fit in one last one. And Cora, I'm going to come to you for this one. Again, it's related to COVID, I think. So this is, I think, again, a general question that a lot of people have had around COVID, which is, have otherwise healthy children died from COVID, or is this really only a risk for kids that have medical complexity? And they're wondering, should we only be vaccinating people at high risk rather than everyone? And why are we vaccinating children that are low risk? So can you put it a bit in context for us? You're the parent of an otherwise healthy kid. How risky is this? Why should they be vaccinated?
Yeah, so great question. We have had deaths in children from COVID. We've had over 20 deaths in Canada, and we've had thousands of hospitalizations. And of those hospitalizations, when they went back, about 30 to 50% were in children who were previously totally healthy, including not having a higher BMI, which we had known had been one of the established risk factors. So these were perfectly fine children, depending on the age group, under 5 up to 50%, and then in the older age groups up to 30% previously perfectly healthy children. And I know I have looked over previously well children who ended up very, very sick with COVID. And again, you have to put in the perspective of how safe this vaccine is, given to millions and millions of children, and yet such a good safety profile. But I know where these questions are coming from, and we ask these questions a lot too, and we're wondering about them. I think the really big question is, in the time, unfortunately, with Omicron, so many of our kids got infected. So many ended up in hospitals, but so many got infected that when they looked at the seroprevalence rates, so how many kids are, a positive for COVID immunity, we're looking at over 70% in the pediatric population, maybe even higher. So now people are saying, well, is it still relevant to vaccinate kids? And there are a few factors that play here. So one is we're learning about how long immunity lasts, both from the vaccine, but also from the infection. We know that immunity from the infection is more robust with the Delta, Alpha, ancestral strains, but less so with Omicron, but it's still there. And we also know that hybrid immunity, so having the infection and having the vaccine, is quite powerful as well. So if immunity lasts years, we're probably unlikely to get another massive wave of hospitalization and death from COVID in our kids. But that's speaking about it at the population level. At the individual level, kids may still be at risk. So without a doubt in my mind, if your child has not had COVID, if your child has had COVID very remotely, so we're talking, maybe 2+ years or 1+ year ago, or if your child is in any way with a medical complexity, for sure, there is clear benefit that your child would need that, at least those 2 doses of a COVID vaccine, because that's enough to prevent severity. So that's enough to prevent kids from ending up in hospital and ending up in ICUs.
Thank you, Cora. That's really clear. And I'm glad someone asked that, because I think it's a really common concern people have. So thank you so much to everyone that submitted all those fantastic questions tonight. And thank you very much for our experts for all your fantastic answers. But before we close, I'm going to go around and ask everyone one final question. The last 3 years we know have been very hard on everyone. And one of the huge things we've seen is just this massive spread of medical misinformation that's cast a shadow on the importance of vaccinations for everyone, especially kids. And I know that's something that I really worry about, is the impact of misinformation on parents. Do any of you, or each of you, could you provide some words of wisdom for parents and caregivers when it comes to navigating misinformation about the health and safety of their children and loved ones? So Dr. Alou, let's start with you.
Sure. I think, first of all, it's amazing that we're actually asking questions, which is what tonight's all about. I think as a parent and as a physician myself, you'd always ask questions. We think about the risks inside and out. And I think finding that safe balance. Everything in life has risk. Driving a car, we can get an accident, taking our kids to their sports game. Getting a vaccine, we look at the good and the bad. In the same way, we ask questions to clarify what's the safest decision we can make our kids, and then ask again the next time, because one day there's a snowstorm, the next day there isn't. Changes the environment and changes information, give you a chance to ask more questions and make the best decision to keep your kids safe.
Thank you. Cora, what about you?
I've said this a few times. The best part about looking after children and being a pediatrician is that the parents are always on your side. So having that ally in the parent is so powerful. And just like Dr. Alou said, having questions, that's normal. It's part of being a responsible, good parent. And if you have those questions, many of your other parents have questions, and probably we as healthcare providers have had questions as well. So if you do have those questions, don't let that fear fester. We're on your side in this, and reach out to your healthcare provider, because they're with you and they're going to help you make the best decision to protect your child, especially as we're coming out of this whole pandemic, and especially as we are seeing other vaccine preventable diseases rear their ugly heads again.
Absolutely. Danielle, what do you think?
Oh my goodness, it's such a great question, because I'm a mom. I have a 2-year-old at home, and I went through the same sort of question and sort of evaluation on what do I do for my daughter. And it's so I think it's so important for people to realize that as healthcare providers, we're also parents and caregivers, and we're making these decisions alongside you. And so my first bit of advice would be to don't be afraid to ask questions. And it's okay to question things and make the goal is to make an informed decision. And so you might read something on the internet, or you might come across it. If it's something that's kind of bugging you, ask a healthcare provider about it, talk about it, have an open conversation and dialogue. And you don't have to make the decision right away either, right? Think about it, ask multiple people, try to make sure that whoever you're talking to is credible and is informed, and see what other people are doing, and have healthy conversations. It's perfectly normal to question things. And I think eventually you'll have to weigh the risks and the benefits, and figure out what makes sense for you and your family. But as a healthcare provider, I feel my responsibility, and I'm sure my colleagues here echo this, is our job is to provide you with information so that you can make the decision for yourself. Ultimately, it is your choice, and that's going to look different for different people. But as long as the information that you're using to make your decision is based in science and not in fear, I think you're on the right track.
Thank you, Danielle. And Patricia, you get the final word on this one.
My advice would be keep in mind that it doesn't have to hurt. You can use a lot of strategies that can help you manage the pain and distress.
Thank you. So thanks so much to all our panelists, and thank you to everyone tonight for joining us. I really appreciate our panelists tonight sharing their expertise and their insights and answering all these questions, and I hope that all of you listening found that helpful. So from my perspective, what a great evening. On behalf of the teams at Children's Healthcare Canada and the Canadian Association of Science Centres, I hope you feel better informed and inspired to help us move the needle, pun intended, to protect our kids and our communities. And I think it's so true. We're here as your allies. We want to be part of that decision making, and questions are normal and welcomed always. So we hope you might take a minute to share some feedback with us through a brief post-event survey that will show up in the chat in just a moment. And your input will allow us to plan future events like this, and to share content that we hope truly matters to you and helps you make informed decisions about your children and their health. So on behalf of tonight's event organizers, thank you again so much for being here, and have a wonderful rest of your evening.